And here with answers to your medical questions in our Ask the Doc segment is Dr. Msonthi Levine. So e-cigarettes, what is your take?
My take is use whatever you can to stop smoking. This segment is correct. We don't really know the long-term effects of e-cigarettes, but that's never stopped us before from trying anything.
Anything.
Yeah, it just sometimes takes a while. Research is very expensive, so a lot of it just will not be done in a timely fashion, but we all know about smoking and how horrible it is. So anything you can use to try and stop smoking, I endorse because we know it causes cancer. It increases the risk of all sorts of medical problems. So if it requires an e-cigarette, that's fine. I think there will be some ongoing studies to figure out long term if there are any injuries or problems with the e-cigarette. So if it's not causing any immediate problems, I say go ahead and try it. There's also the other nicotine replacement products over the counter that have been out for a long time. Acupuncture, cold turkey, just whatever it takes to cut down and quit is really what I try to endorse.
Is this truly the hardest habit to break?
I think for most patients, absolutely. This will be the hardest thing that they probably will ever have to do. The longer you smoke, the harder it is to quit. Certainly if you can stop smoking before your 30s, it's pretty easy. I see that all the time, but beyond the 30-year mark, for whatever reason, it tends to just be almost impossible. It takes an average of 10 attempts to stop smoking, and sometimes we endorse just reduction. Instead of a pack, how about 2 cigarettes a day? It's still smoking, but it's a significant reduction in the insult and the stress on your body. So that might even be a goal for some people.
All right, on to some of our viewers' medical questions. This person says, is it possible to miss your period for 2 months and then have one? I know I'm not pregnant. Also, can stress cause you to miss your period?
Yeah, absolutely. Periods are hormonal, so anytime you get stressed, it can affect your hormones. Certainly, we see that all the time. Pregnancy is the thing that we want to make sure that you're not. She says she isn't, and we don't trust patients. We always check anyway. But yeah, that's always a common problem. Certainly get to your gynecologist for a full evaluation.
Okay, another person. I've had a headache for over a month and a half with blurred vision, numbness in my face, also swelling of my hands and feet. What could this be? I've been to a doctor. They have no clue. My next step, neurologist.
That sounds accurate. A lot of times headache and complicated migraine is probably the most common thing I would think about. It can cause neurological symptoms, blurry vision, numbness and tingling, sometimes not able to talk or walk accurately. Certainly you need blood tests, brain scans to make sure you're not having a stroke, you don't have a tumor or a mass, but certainly a complicated migraine would be the top of the list. There are good medications on the market, Neurontin, Lyrica, Topamax to name a few, but certainly if your PCP can't handle it, get to the neurologist.
Okay, another question. If your urine is cloudy all the time, could it be a possibility there's something wrong with your kidneys?
Yeah, absolutely. You know, the urine is made from the kidneys, and certainly if it's cloudy, that might mean it's infected or have white cells in it, or it could have some sort of debris, could have blood in it. So certainly anytime there's any discoloration, just get a simple urine analysis. Most physicians can perform that. If anything looks abnormal, then we normally shoot them to the urologist to get a full GU workup.
All right, we've got lots of other questions. We'll get to those in just a minute, so don't go away. Dr. Levine will answer more of your questions next on Live at 5. We're back with Dr. Msonthi Levine to answer more of your medical questions. 71-year-old female wants to know, can an adult have a cradle cap like a baby would have?
I guess it's possible. I don't see it that often. It has a lot to do just with being a young person as well as being an older person. Fungal infections are a common cause a lot of times of dermatitis of the scalp in older adults, and we normally can treat that with medicated cream as well as tablets.
Okay, a 51-year-old male has a 30-year-old son that is currently addicted to smoking synthetic marijuana. Can smoking synthetic marijuana cause seizures?
I would say yes. Anything that can irritate the brain or aggravate the brain, stress the brain, can potentially contribute to seizures. Any type of toxins, alcohol, medications, trauma to the brain. So I would say yes, certainly stop smoking marijuana, get on some seizure medications, but get a full workup just to make sure that there's not anything else going on.
Okay, a 61-year-old male says when he lays on his side in bed, he feels a twitching in his chest, almost like a muscle spasm, but he has a normal pulse. Any idea what it could be?
It's probably musculoskeletal. We get a lot of that when someone bends down or moves. We think of musculoskeletal disease. Certainly heart disease is always a common concern and certainly get a cardiac evaluation if you are concerned. But you certainly can probably try some anti-inflammatory medicine such as Motrin or Advil just to start off. Certainly a chest x-ray might be a good idea if the problems don't go away.
Okay, a 68-year-old female. What would be the reason for a positive ANA when all tests for the autoimmune disease came back negative?
Yeah, it's a good screening test for most diseases such as lupus or autoimmune diseases. A lot of times that test is very sensitive, meaning we're going to have a lot of patients who come back positive. You tend to have to get confirmatory lab to rule that in or out. So that's like any other screening test. It's very sensitive. You may have some false positive tests. It's up to the doctor to do those confirmatory tests, do a physical, talk to the patient, try to put it all together. It's a small piece of the puzzle when diagnosing someone with an autoimmune disease.
Okay. An 80-year-old female has developed a tickle in her throat and she coughs until she almost needs to throw up. What can she do?
A lot of times it could be medication related. Medicines like lisinopril can cause cough. If you smoke, certainly that's a problem. Allergies with all the yellow dust, that can be a problem. So antihistamine would be good. Acid reflux, so you can try maybe Prilosec or Protonix. You might have all three of those problems. So typically we can resolve coughing. Chest x-ray is always a good idea, certainly if you've not had any testing in a long time.
Okay. This person says they're a bad diabetic. They don't think they're doing well. They're not sure if it's them or their doctor not doing what they need to be done. Any idea what this person needs to do?
It's a team effort. Anytime you're dealing with a chronic illness like diabetes, it requires the physician and the patient to work together. Certainly I would advise this person to get back to their doctor and just talk with them one-on-one about their concerns and get a response from the physician, and just ask the physician if they feel like they're qualified to deal with the diabetes and what their game plan is. But it's not all the doctor, it's not all the patient, it's a team effort coming together.
Okay. This person is 5 months pregnant and they've been having stabbing pain in their right breast. What could it possibly be?
I mean, a lot of things are going on hormonally and physically when you're pregnant. Certainly that could just be engorgement of that area because they're pregnant, and certainly that might be some stretching of the skin. It might be painful for them. Certainly if there's any skin changes or drainage from the nipple area, certainly get to your physician to rule out infection or masses or tumors. Don't let anything go. I mean, if this person is having this symptom, especially with a pregnancy, you don't want to blow this off, so I would go in for an evaluation.
All right, Dr. Levine, as always, we appreciate your time.
Yes,
and you can always visit our website and see the answers to these and other medical questions posted online. And if you'd like to have Dr. Levine answer your medical question, you can always mail us at the address listed on your screen, fax us 892-7305, email us at laf@kftm.com, or you can post those questions every Monday on our KFTM News Facebook page.